Hello, my name is Kaylee Steele, and this poster presentation is the effect of Lsvt Big on gait, balance, and mobility in a person with relapsing-remitting MS. It's a retrospective case study following a 25-year-old female diagnosed with relapsing-remitting MS 5 years prior, going through 4 weeks of physical therapy treatment guided by the Lsvt Big protocol. This patient was working full-time and complained of difficulty lifting objects at work, walking on uneven surfaces, and reported being off balance often. She stated that she had tripped and fallen several times and was hopeful that physical therapy would help. MS is one of the most common neurologic conditions affecting over 2 million adults worldwide. There are 4 types of MS, with relapsing-remitting MS being the most common. It is characterized by intermittent and recurrent periods of inflammatory demyelination and transection of the axons in the central nervous system. Patients with relapsing-remitting MS complain of episodes of symptoms worsening, followed by varying degrees of recovery and stability. Much like the patient in this case study, the most common symptoms include mobility impairments, muscle weakness, impaired balance, along with fatigue, depression, pain, disability, spasticity, paralysis, visual and sensory disturbance, cognitive dysfunction, and bladder and bowel symptoms. Lsvt stands for Lee Silverman Voice Treatment, and it has gained traction and research since 2010 as a treatment option for those with Parkinson's disease. The Lsvt Big Program is an intensive amplitude-based exercise program for the limb motor system and the re-education of the sensory motor system. The Lsvt programs are based off from over 25 years of research and put into practice the principles of neuroplasticity. These principles include intensity, complexity, repetition, salience, timing, and specificity. And they are used in each Lsvt treatment and are encouraged in daily home exercises for these patients. While there is limited research on the effectiveness of the Lsvt programs with other neurologic conditions, there may be crossover effects due to the approach in terms of neuroplasticity. This case study began with an initial evaluation of the patient to ensure that the patient was safe and appropriate for physical therapy treatment. Following the initial eval, the patient participated in an Lsvt Big assessment and attended 4 consecutive physical therapy sessions per week for 4 weeks. The Lsvt Big protocol calls for each session to last 1 hour. However, due to concerns of increasing the core body temperature for a patient with MS, more breaks were given during the physical therapy sessions, increasing the time of these sessions to almost 90 minutes at some visits. Vitals were collected at the start and end of each session. These sessions included maximal daily exercises, functional component tasks, big walking, hierarchy tasks, and each session ended with a review of daily homework and carryover assignments. The functional component tasks and hierarchy tasks were chosen in part by the patient so that we could focus on areas in which she was having the most difficulty with. As you can see in these pictures, this patient demonstrates decreased thoracic rotation and arm swing, along with a shortened stride during gait. In these pictures below, we can see the patient attempting these maximal daily exercises at the Lsvt Big assessment, which required much more effort and concentration to perform these large amplitude movements. These smaller pictures with the lady in purple have been taken from the exercise sheet given to the patient for daily exercises. There were 2 self-report surveys used during this case study, the Lsvt Questionnaire and the Functional Assessment of Multiple Sclerosis Questionnaire. The Functional Assessment of Multiple Sclerosis Questionnaire improved by 32 points from the eval to discharge. The Lsvt Questionnaire, given at the conclusion of physical therapy program, resulted in positive comments from the patient about improvements she had noticed in the course of her daily life. As you can see under the Outcomes section, this patient made gains from the eval to discharge in her range of motion, strength, and in most every functional outcome. However, only the 30-second sit-to-stand test, the single-leg balance test, and the 5-time sit-to-stand test were significantly improved. These improvements suggest that Lsvt Big treatment may have crossover effects into other neurological diseases and disorders and could be a viable treatment option. Continued research is needed to support the findings of this retrospective case study and advance the Lsvt Big program model into a wider-based approach for varying neurological diseases. In order to read the full case study and to see in more detail any of the topics discussed in this presentation, along with the references used for this case study, please click the link at the bottom of the poster. Thank you for your time.